Hello, my name's Adrian Richards. I'm a plastic and reconstructive surgeon and also the surgical director of Aurora Clinics. In this video I'm going to be talking about tuberous breasts, and then first in the series on this topic I'm going to be talking a little bit about what tuberous breasts are. So tuberous breast is a particular sort of what we call a congenital breast abnormality, which means that you're essentially programmed to develop your breasts in a slightly unusual fashion. Now, tuberous breasts are also called tubular breasts and are also called constricted breasts. In essence, all of these really mean the same thing. What they mean is the base of the breast is constricted, so it's narrower than normal. And what this tends to result in is a high fold under your breast, so you might have a short distance between the nipple and the fold under your breast. So this should normally be about 7 to 8 centimetres, but in some people the fold's very high and the distance between the fold and the nipple may only be 3 to 4 centimetres. So that's one of the mildest forms of tuberous breasts. Now, the whole spectrum of the abnormality can be much more severe, and some people have really very narrow bases of their breasts and the breast is very elongated, often with a herniated or a domed areola. That's the brown area around the nipple at the tip. And often people growing up, are aware that their breast may not look like they see, in magazines and things, but they're not really sure what's wrong, a bit embarrassed, perhaps don't discuss it with other people in their family. So if you are one of those sort of people who's concerned that your breast may not be developing in quite a normal way, I just wanted to reassure you, it's very, very common. And it can be treated really quite easily with surgery. So don't worry. The sensible thing to do is probably talk to your family about it, people that you are close to, and then perhaps come in and talk to a plastic surgeon about the issues. Don't be worried. Don't suffer in silence. Come in and have a chat about it, and then we'll be able to tell you whether you have got tuberous breasts, and also what the options available for you are. And remember that most of these can be relatively simply treated, perhaps with a breast enlargement and some sort of surgery to the breast tissue itself. So in the next video I'm going to be talking a little bit about the options available for you to have your tuberous breasts, if you have them, treated. So again, thanks very much for watching the video. Please have a look at the other videos on breast enlargement and uplifts, which will give you a much better understanding of what's involved in each of these procedures, and we are going to be showing pictures of people with tuberous breast deformities, so you can have a look at the before and after photos of those to see the kind of results you can expect regarding this type of surgery.